Drugs of abuse are again very important. There are a lot of drug abusers out there, drug addicts. They're also known as this. These drug of addictions can cause a lot of toxicological, a lot of overdosage deaths that are usually observed. So we even have to go through these drug of abuse comprehensively just to get an overview. What are the usual drugs of abuse? What are the signs and symptoms to these drug of abuse? How can we usually investigate a case? And how will we usually, if we come across any drug abuser, what are the sign and symptoms that will tell us that this person is a drug abuser? Even the death has not occurred, but still we have to investigate and we have to go through these cases. So sometimes the deaths in such drug abusers occur. A lot of signs and symptoms point out towards their addictions, and that has to be noted by the forensic practitioners or whosoever is performing these autopsies that are very significant. So in this section, we'll be discussing the opioid group of drugs over here. First of all, we'll go through the autopsy appearances. What are the signs and symptoms in drug abusers? The toxicological analysis are again very important. How can we go through these toxicological analysis? For example, the samplings are also routine, that are in routine sent for any suspicion of poisoning is over there. We'll send the blood, we'll send the urine, the CSF, the subarachnoid fluid. All of these are basically sent to the chemical pathologist for further assays. And then the tissue sampling, that is the brain, that is the liver, the kidneys, they are sent to the histopathologist for the tissue analysis in detail. So all of these samplings are discussed over here. And then the hallucinogens, that is basically the drugs that are causing hallucinations of the auditory type or even the visual type. In a lot of cases, they are discussed over here. And then the methadone. Methadone is even therapeutically being used for the heroin addiction, but it has been stated that it has its own addiction phases, and sometimes its toxic effects have been observed. So all of these are discussed over here in this section. And then the phencyclidine is another drug of abuse that is being commonly used, and what are basically the markers for the identification of such drug abuser, and even the deaths can be investigated if such suspicions are observed in a lot of cases. So all of this is going to be discussed in detail over here in this section. Now, first of all, the autopsy appearances in the drug addicts. It can be the injection marks that are also known as the trail marks. Sometimes there is, if a single vein is being pricked at a lot of times, phlebitis is observed. That is, there is thickening of the walls of the arteries and the veins, and that is basically going to be observed. We can even track the vein that is being commonly pricked. So these are basically the trail marks that are formed on the forearms or even on the front aspects of the thigh. They're commonly being observed. Skin popping. It's basically a phenomena in which when the injection is pricked at a lot of times at a single site, there is fat necrosis, there is sclerosis, abscesses, and there is a chronic myositis. That is, myositis is basically the infection of the muscles. So this chronic myositis is observed in a lot of cases, and this whole phenomena is termed as the skin popping phenomena. So it's again going to point out towards a drug addict or a drug abuser. And then we'll have the tattoos. So the tattooing is again very common in such drug abusers or even the drug dealers. They have their specific tattoos. For example, a C indicates for cannabis, an E indicates for an eater, and then these basically, all of these are basically an indications that such person is using so and so drug. So these tattooing is again a common phenomena that is seen in these drug abusers. So they are also an indication. Then the body is emaciated, in a dirty state. These are all basically signs of self-neglect. The person is in a state of self-neglect. He's a drug abuser. He's almost all of the time in an unconscious kind of a drowsy state, and so he'll not take care of himself. Hygienically, he'll be in a poor condition, and there will be signs of infection also observed on the skin and even in a lot of other sites. Now, what are the autopsy appearances that are observed in such a case? Rarely there'll be necrosis and even the loss of the phalanges from the thrombotic or the septic emboli that can be observed on the autopsy. So the trail marks are again very important. The injection site marks are seen even in this picture. There are these injection site marks on the anterior cubital fossa, and so these are again very important, or even in the forearm they are observed, even in the front aspects of the thigh. So these are the common sites used for the injections. The old injection marks are again very important, sometimes with associated bruising, that is basically indicating the fat necrosis and the phlebitis. The veins may show the overlying fibrosis where phlebitis has occurred, and the old venous thrombosis with firm cord-like vessels under the skin. It's again very important and indicative of any drug abuser. Now, the toxicological results are again very important. The anterior cubital fossa is a normal injection site. It is difficult to measure the exact concentration of the drug after death. There will be lethal doses, there will be a dependence, and this dependence can be physiological as well as psychological in a lot of cases. And then there will be a tolerant kind of a state. Then we'll observe the quantitative analysis is more useful in a lot of cases. Methadone. So methadone, as I was already emphasizing on this fact that it is sometimes therapeutically used for the heroin addiction, it is again very important, but it has been observed that it has its own dependency and it has its own toxicological effects that has been observed in a lot of cases. So the most deaths follow the oral administration, and then we have, due to the lack of tolerance, there are some of the physical signs and symptoms that were observed in this methadone poisoning. Now, even 50 milligrams may be lethal in a lot of cases. So it depends person to person what is the fatal dose over here. Then we have hallucinogens that are basically they can even produce the visual or the auditory kind of hallucinations over here. They are the primary cause of death in a lot of cases. Some may lead to a traumatic kind of a death, and then we have the direct toxic effects in a lot of cases. The autopsy findings are negative, and so they are sometimes very non-specific in a lot of cases. And then we have the phencyclidine. Phencyclidine is again very important. It's a drug of abuse in a lot of cases. And it is also known as angel dust by a lot of drug dealers. And PCP is the normal common abbreviation used for this phencyclidine. It is used in combination with the other drugs for the drug of addiction, and it causes hypothermia, that is the increase in temperature, intracranial hemorrhages, and a high output cardiac failure in a lot of people. So in this section, basically, we dealt with opioid poisoning, with phencyclidine, a lot of drug abusers, and how can we detect if a person has drug addiction. So there are a lot of signs to it. That is the end of this section. Thank you for watching sqadia.com.